qui s'est aventuré sur ce chemin. Voilà, donc,
alors bonjour à tous, je suis le docteur Joubel Shamstouha, je suis installée à Casablanca. Je suis ravie d'être parmi vous pour vous parler un peu du laser Photona HAIRestart dans la prise en charge de l'alopécie. Alors, how the laser changed my approach on hair restoration. I have no conflicts of interest to declare. Hair loss stemming from different types of alopecia, such as androgenetic alopecia and alopecia areata, negatively affects over half the population worldwide and in many circumstances causes serious psychosocial distress. Current treatment options for alopecia, such as minoxidil, finasteride, topical and intralesional steroids, vary efficacy and side effect profiles. Laser therapy offers an addition or alternative to pharmaceutical and surgical treatments of hair regrowths, with non-ablative lasers being preferred over ablative lasers in terms of safety and downtime. Photona HAIRestart has proven to be an effective method for treating hair loss disorders. Using the unique Photona Smooth mode, it acts in a non-ablative manner, producing precisely engineered mild thermal pulses, triggering the scalp in a safe and controlled way, and leading to an increase of hair density and thickness, promoting new follicle growth and preventing further hair loss. When it comes to the mechanism of action, studies show that laser thermal pulsing of the scalp during HAIRestart treatments activates signaling pathways inside the skin, resulting in the production of growth factors and new extracellular matrix proteins that trigger the regeneration process. This leads to vasodilation and neoangiogenesis. Thus, blood flow is increased at the dermal papilla. Laser therapy hence stimulates the active growth stage of the hair cycle, which is the anagen phase. I would like to share with you some of the cases I have treated in my office. So here's the case one. It's the case of a 30 years old male patient with confirmed AGA, lasting for 8 years. PRP injections with a 2 years use of minoxidil were enabled to stabilize the hair loss and thinning. His HAI was assessed as a grade 3 of Norwood and Hamilton classification. Finasteride was not considered due to potential side effects. Erbium YAG laser was proposed as an alternative therapy compatible with patient's demand combined with PRP injections. The patient was subjected to 4 treatments 1 month apart. No laser-related side effects nor pain developed during or after treatments. So for the parameters, I used the Photona SP Dynamis, the smooth mode. The fluence was 7.5 joules. The frequency was 3.3. I used the handpiece PS03X. The spot size was 7 millimeters, and I did 5 passes, no overlapping, no cooling. The result was after 4 sessions, 1 month apart. So here's the case 2. It's the case of a 42 years old female patient with confirmed AGA lasting for more than 10 years. Her AGA was assessed as a grade 2 of Ludwig classification before treatments. PRP injections alone were unable to stabilize the hair loss and thinning. She was allergic to minoxidil. Erbium YAG laser was proposed as an alternative therapy compatible with patient's demand combined with PRP injections. The patient was subjected to 4 treatments 1 month apart. No laser-related side effects nor pain developed during or after treatments. So for the parameters, I used the Photona SP Dynamis, the smooth mode. The fluence was 7.5 joules. Frequency was 3.3. I used the handpiece PS03X. The spot size was 7 millimeters. I did 5 passes, no overlapping, no cooling. The result was after 4 sessions, 1 month apart. So here's the case 3. It's the case of a 39 years old female patient with confirmed AGA lasting for more than 10 years. Her AGA was assessed as a grade 2 of Ludwig classification before treatment. She was on minoxidil for 2 years now. She had already tried PRP injections combined with vitamins, but it was unable to stabilize the hair loss and thinning. Erbium YAG laser was proposed as an alternative therapy compatible with patient's demand combined with PRP injections. The patient was subjected to 4 treatments 1 month apart. No laser-related side effects nor pain developed during or after treatments. So for the parameters, it was the same thing. So it was smooth mode. The fluence was 7.5 joules. Frequency was 3.3. I used the handpiece PS03X. The spot size was 7 millimeters. I did 5 passes, no overlapping, no cooling. And the result was after 4 sessions, 1 month apart. So here's the case 4. It's the case of a 35 years old female patient with confirmed HGA, lasting for about 8 years. Her HGA was assessed as a grade 2-1 of Ludwig classification before treatments. PRP injections combined with vitamins were unable to stabilize the hair loss and thinning. She was allergic to minoxidil. Erbium YAG laser was proposed as an alternative therapy compatible with patient's demand combined with PRP injections. The patient was subjected to 4 treatments, 1 month apart. No laser-related side effects nor pain developed during or after treatments. So for the parameters, it was the same thing. So here's the case 5. It's the case of a 45 years old female patient with confirmed HGI lasting for 10 years. Her HGI was assessed as a grade 2-1 of Ludwig classification before treatment. She had already had 2 hair transplant sessions before treatments. She was on minoxidil for 5 years before treatments, and she had already tried PRP injections with vitamins. Erbium YAG laser was proposed as an alternative therapy compatible with patient's demand combined with PRP injections. The patient was subjected to 4 treatments 1 month apart. No laser-related side effects nor pain developed during or after treatments. So for the parameters, it was the same thing. So here's the last case. It's the case of a 40 years old female patient with alopecia areata lasting for 2 years. She was on topical steroids combined with minoxidil for 1 year now. Erbium YAG laser was proposed as an adjuvant therapy to her medical treatments. The patient was subjected to only 1 session now. This is the result 4 weeks after the first treatment. The patient says she never had such hair density during her previous treatments. So for the parameters, it was the same thing. So in conclusion, although medically benign, alopecia can cause significant emotions and psychosocial distress for affected patients and their families. Fotona HAIRestart is a unique and innovative patent feature of Fotona Smooth modality that promotes hair growth gently, safely, and efficiently, regardless of the alopecia's grade and duration, nor the patient's age. This treatment can change lives by enhancing patient self-esteem and confidence. Thank you for your attention.
Thank you for your courage. You made it in English, so we have to be proud of her. So we still have another topic right now about hair restoration. So we can, if there are questions, we can combine both, so we can make things easier. So come to the stage.